we have Elliot Weiss, who will tell us more about the policy landscape and our goals to continue moving telehealth forward. So, Elliot, thank you so much for taking the time today, and welcome to the call.
Thank you very much, Art, and really appreciate you guys having me on here today. I'm really pleased to be representing the American Telemedicine Association and our membership, who is working really hard to advance the policy landscape for telehealth right now. As Eric and Dr. McCants-Katz described so well, there was a lot of policy change that took place during COVID-19 at both the state and federal level. And so much of what's happening now at the federal landscape is an adjustment to figure out what our new normal will be. Right now, as you know, we've heard, patients have really started to adopt telehealth. They have integrated it into the way that they get healthcare for themselves, for their families. And I would also note, for schools and for their communities. A lot of the community health options have really expanded, and Dr. McCants-Katz mentioned Medicaid is a big piece to this. We're reaching underserved populations now that were not previously accessible to us because of this, and that's a huge deal. So part of what the American Telemedicine Association is working to do, I work on their federal advocacy team, we also have a state advocacy team, is identify the policies that were so successful during this period of COVID-19 and keep those in place for as long as we can. And I'll just run through a few of those things that have been so useful and what we're doing to advance them. First, at the federal level, we're working really hard to continue telehealth flexibilities that were put in place for the Medicare program. So much of those involve not only telehealth, but also removing regulatory restrictions that were previously in place on providers like nurse practitioners, physical therapists, and so many other providers who were reaching patients. As we know, mental health is not just from those mental health providers, but also the primary care providers. So nurse practitioners, physician assistants, and physicians alike are really a key part to advancing those policies forward. We've also sought to continue to support telehealth in high deductible health plans and Erisa plans. As some of you know, telehealth was offered pre-deductible and high deductible health plans during the COVID-19 public health emergency. We want to see that continue. It's been a huge advantage for a number of patients to been able to have that additional affordability. I'll also note part of what we're trying to advance here, some of these policies have seen movement in Congress and some have not. The House of Representatives in about a month ago actually passed what's called HR 4040, which actually was a legislative fix to allow a lot of these flexibilities to continue through the end of 2024. And we're hopeful that the Senate will act on those as well. We're doing a huge number of meetings to try to advance that. Another piece of this puzzle that we've been working with in the House and Senate is a repeal of the telehealth mental health in-person requirement. There seems to be a great deal of support for this, but I know a number of members of Congress are worried about whether or not that'll increase costs associated with mental health treatment. So we've been working to identify other areas where they might be able to save money so that we can continue to have this great access to mental health services via telehealth. And again, great support in Congress. We're really hopeful that we're gonna move that forward as well. We're also working towards a guarantee for telehealth coverage in federally qualified health centers, rural health centers, the Indian Health Service, TRICARE, and of course, the Veterans Health Administration has been out front on mental health services in a huge way, fully integrating it into their primary care services and throughout their care teams. There's actually a proposed rule that is out for comment from the Veterans Health Administration right now, where they're talking about integrating full care teams to be able to deliver healthcare across state lines, across the country for veterans, which is a huge move forward for mental health. They're really setting an example for the rest of the country to follow. We're hopeful that states will follow that model as well. And finally, we're working to ensure providers are able to continue to prescribe controlled substances via telemedicine, regardless of the patient's location. So much of the mental health services that are being provided are to patients in really challenging situations that otherwise would not be able to go into an in-person healthcare setting. And so when primary care services are being delivered, we know that it's important that controlled substances, particularly as we get into medication-assisted treatment for, drug abuse and things of that nature, it's very important to have access to that. So we're working to make sure that continues to be accessible. We've had conversations in Congress and with the administration about how we might be able to do that, and we're optimistic about it. At the state level, we, are really looking to defend significant gains that the telehealth community achieved during the pandemic. And we've also had to push back against some opponents that think that brick and mortar care is the only care that should be delivered. We view at the American Telemedicine Association that telehealth is part of an integrated healthcare delivery system. And so we're not saying that telehealth is better. We're not saying it's worse. We're saying it's part of healthcare. And that's what we continue to advocate for at the state level when we're talking to governors, when we're talking to state legislators alike. We're working really hard to promote regulatory flexibility. So working with medical boards, nursing boards, psychology boards to advance interstate compacts, licensure flexibilities, and other ways in which we can remove those regulatory hindrances when providers and patients are seeking to connect with one another. We think those are really critical. I personally have spent time advocating for these compacts, and it's really important to remove those regulatory burdens. So we're going to continue pushing on that. One specific policy I'll note, the Uniform Law Commission has just approved a new policy that'll be in state legislatures next year that actually is seeking to allow states to enter into this uniform law, and it would allow providers with existing relationships with patients to treat those patients in any of the participating states, regardless of what level of provider they are. The huge regulatory flexibility, and it's been endorsed by a number of organizations. So we're hopeful to see that be advanced next year. And then modality neutral frameworks is a huge deal for the American Telemedicine Association. So all of this is about increasing access to care, increasing the amount of equity that we see in our healthcare, reaching urban patients, rural patients, patients of means, patients who've really struggled to have resources to access healthcare. We're trying to level that playing field and make sure that everyone has access to these services and promote them across the board. So with that, I'll turn it back to you, Art. Thanks so much for having us today.
Elliot, thank you so much. My gosh, you were doing amazing things. I remember in 2020, I had the opportunity to be a fly on the wall for a couple of the calls where they were like, what's standing in the way for you delivering care? And they were just pulling all these policy obstacles out of the way. So again, thank you for everything you are doing and have done. You're making impact on so many lives. So thank you with that.
Thank you.